This week on Africa Health Check.
I am practicing social distance. I'm also making sure that I always sanitize, wash my hands with soap.
In a way, I'm taking all these measures, like washing my hands. I'm also telling people who are around me to also do the same.
We shine our spotlight on African women and women-led activities.
So we give women access to the loans, the grants, all these things that they need that they typically don't have access to, or I would say the women maybe from the last generation found it difficult to actually break.
In the fight against the COVID-19 pandemic. Welcome to Africa Health Check, where we reflect on Africa's response to the COVID-19 pandemic. I am Khokhontlejang Paladi. We often say that women are the face of marginalization, the face of poverty, the face of discrimination, the face of many social ills and challenges we face in our society. And the reason why, as women, we are often acutely affected is because we are often at the forefront as caretakers and caregivers. On today's show, though, we will be talking on the positive side about women's role in the response to COVID-19. But before we do that, let us have a look at Africa in numbers. This week in Africa in numbers, we look at the daily new COVID-19 infection rates on the continent and highlight the top countries reporting the highest 7-day average rates as of the 5th of February 2022. Top of the list is Tunisia reporting over 5,500 infections per day, followed by Libya with a daily average of 3,700 infections. South Africa comes third highest with 2,900 daily reported infections, and Morocco and Egypt wrapping up the top 5 with 2,400 and 2,200 reported infections per day, respectively. As always, for more on these and more statistics on the COVID-19 pandemic, log on to the official Africa CDC website. On today's episode, we will be discussing women-powered activities in the response to COVID-19, and joining me in that discussion, we have Nabuma Shamin, who is a tech entrepreneur and a motivational speaker. We also have our usual commentators, Dr. Marianne Morethi, the current chair of the Department of Biology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who is a pharmacist and a pastor from Ghana. But before we hear from these experts, let us have a look at this week's feature.
My name is Eti. I'm the founder of Economy, a financial technology platform that empowers women to grow their income, build their capacity, and build their network. About 37% of women in sub-Saharan Africa don't have access to bank accounts, not to talk of saving. But how can we support these women to continue generating income, continue making money, continue building their capacity, so even if they decide to even stay at home, they can still continue making an income. So we give women access to the loans, the grants, all these things that they need that they typically don't have access to, or I would say the women maybe from the last generation found it difficult to actually break. But with her economy, we're trying to break those barriers that would stop women from progressing. We've seen a lot of challenges that have happened, especially to women during this pandemic. A lot of people have had to shut down their businesses because it wasn't relevant anymore during the pandemic. We also saw an increase in the number of people who were abused by their spouses. So I was speaking to women all the time. There's a lady who currently we've had to provide accommodation for because her husband was literally hitting her and molesting, her child. So it's important for you to just be stronger, just to open up. And just from listening to some of these challenges that these women are going through, you notice that a lot of them are being amplified just because of the pandemic. One of the ways we've been able to fight against the pandemic is basically by educating people. What are the things that you can do to protect yourself? Things like, washing your hands, providing sanitizers, distributing face masks. We've also been able to provide grants for people whose businesses were affected by the pandemic. We started a fund called Phoenix Fund during the pandemic, and we got a lot of people to apply. I think we gave out grants to about 22 people who were affected by the COVID-19 pandemic. So we've just been educating people. I also leverage my social media because I have a huge following on social media, where we have also conversations regarding the pandemic, even the vaccine. We've gotten testimonials from people who maybe had diabetes or maybe are sickle cell patients as well. They've taken the vaccine and they've come back to come and share their experiences, and that has also encouraged other people who also have similar conditions to also take the vaccine or decide whether they're not going to take the vaccine based on the experiences of others. So we're just basically doing like peer-to-peer learning, knowledge sharing, and just letting people know that it's important for you to understand that this pandemic is here to stay, but you have to protect yourself and manage yourself better. My own joy mainly comes from seeing the women we've actually empowered. Moving these women from zero to hero, from nothing to something, just seeing how their lives are being transformed just as a result of me or my organization just being a part of their own journey has just been absolutely amazing, and it actually gives me the ginger to want to continue to do more, want to empower more, want to give more.
Truly inspiring and really empowering work about young women who are involved in the COVID-19 response, and I really hope that you continue with the fantastic work that you're doing in your respective country. But we're going to dive into the discussion. Remember, we are talking about women-powered activities in the response to COVID-19. And I'm going to start with our guest for today. Charmaine, maybe you could just introduce yourself, tell us who you are and where you're from.
Wow, thank you for this opportunity. I'm glad to be here. My name is Navuma Shamim. I'm a tech entrepreneur, a motivational speaker. I'm a Bloomberg New Economy Catalyst, and I'm a co-founder of Shield AI Lab. We use the power of artificial intelligence to avail women with key chronic services, that is consultation, referral, and mobile telemedicine, to organize groups of women in the rural areas and also those in the urban areas. Currently, we are operating in more than 10 countries in Africa. And in Uganda, we operate in the town areas, that is Kampala, also operates in the eastern, the southern. And we are also moving to the northern area of Uganda.
Lovely stuff. Maybe before we get into your artificial intelligence project, let us just find out a bit about you, Charmaine. Where did this tech and, AI kind of background start, or inspiration? Is there a background story to it?
Oh, yes. It started all the way back when I acquired breast cancer, I think. But it was in the early stages, so I got medical attention and then I happened to survive. But the pain that I went through was so much that I saw people had lost hope, and they were like, we are dying anytime. We are losing, like everyone had lost hope actually. And then they are saying their last words and all. So if you're among those people that have been able to make it, you come up and then you are able to impact other people, because many people have lost their lives to many chronic illnesses, specifically cancer here. And so if you come up and say, I am offering breast and cervical cancer screening services and other chronic related illnesses to specifically women who are impacting the different communities in different countries. These are mothers of different nations. They have children. So if a mother's life is disturbed or they get to lose their lives, the children they leave behind, the families they leave behind are all broken. So with that, I started offering the breast and cervical cancer screening services to women, specifically first cancers, and then later added other chronic related illnesses like diabetes and blood pressure and all that. So that is how the whole thing works. And this has impacted so many women out there. And it is my passion and it is my pleasure to see so many people's lives being saved. I mean, it's better to check than to treat the earlier better. So, yeah.
Wow, really powerful indeed, living a purpose-driven life. You know, sometimes there can be so much hesitancy with taking up technology, especially when you start talking about artificial intelligence and chatbot, which is something that we're not so accustomed to. So maybe just very briefly take us through the uptake of your AI project at the initial stages and now in response to COVID-19 to increase people's awareness and access to services. How has been the uptake?
Okay, thank you so much for that question. Technology. Days before, we talk about technology to people, and then they're like, that will come like 10 years after, and then we don't have to rush for it. It was like an option for everyone to use technology. I mean, if we're going for conferences, there's nothing like Zoom or something. People take it as option. You can have a Zoom meeting, but I'm coming. So when offering these services using the power of artificial intelligence, why I did that is that I could not offer services to people like you offer services, let me say to like 100 people, like maybe in a day. First, look at the situation whereby you are a medical doctor and then you're offering services to women. I mean, the efficiency a doctor can have in the morning, the person who comes in first, second, third are going to get that attention, and that. But after some time, our efficiency keeps on reducing. We get tired. We have a thing about this. You cannot stop that. So the patients who come late in the evening will not get that attention, but they came and they want that good service. So you realize that you cannot offer that efficiency, and then you cannot have like 100 doctors to do all that. You will not. You are a small startup and you've just begun. So, and that is how the artificial intelligence comes in. So the use of artificial intelligence and technology is something that has revolutionized during the pandemic, because this was a situation whereby no movement, people are at home, you move, there is COVID, and like the beginning of the COVID, leave alone now the mutations that are taking place, COVID Omicron, Delta variant, and all that. So now this is the COVID that has come in, and then it's new, and then all countries are scared, and then they're putting lockdowns and everything. So whoever did not have something that was online, they thought they had the need to.
Thank you so much, Shamin. I think you're absolutely right, because we had very limited options, because we couldn't, move around. We couldn't be in direct contact with a lot of people, including service providers. Many of us had no option but to rely on technology. So that's kind of what accelerated the uptake of these new innovation and technology mechanism. But really incredible work that you're doing, and I really congratulate you for it, and your team as well. I'm going to just get Reverend Anthony Champon to weigh in here, and maybe you can share the experience of Ghana. What have been some of the incredible, outstanding activities that were women-led, that were undertaken to respond to COVID-19 in your country?
Yeah, thank you very much. First of all, let me pay tribute and commend our African women as always, because I would say that for me, from where I come from, the woman is the soul of the African family. The woman's role in our part of the world has been phenomenal, and so has it been during the COVID times. I believe that, and then I will pay tribute to our government, who recognized this contribution from our women and so allowed them, even during the lockdown periods, to be able to go to their farm and non-farm economic activities. And like I said, they are the breadwinners, most of them of their families. So somehow the resilience of the African woman is something to be really researched, because whilst everybody is running away, everybody is hiding, the African woman is championing, the survival of their families in many ways. So I would say that the support, the intra-group support, women deriving strength from other women, advocacy groups, reaching out to them, religious leaders building capacity to reach out to those that have been on the wrong side of the pandemic that is suffering attacks. I think by and large, the African woman, the Ghanaian woman, has been stalwart and defensive and protective and contributors to the fight of COVID where their families are concerned.
Wow, absolutely incredible, Reverend Champong. I don't know whether to say amen after this, since you are a pastor after all, but such beautiful sentiments. I wish every woman, every young woman, every girl child in Africa would have an opportunity to hear what you just said, because indeed women are the pillars of strength. They are the builders of family, of communities, and the whole nation as wide. And I think sometimes we don't say this enough because it's almost obvious. Somebody once told me that how many of us actually ever thank our mothers, our aunties, because we think, they're just doing their jobs. We don't need to say thank you, right?
That's right.
Absolutely. I'm going to go to Dr. Marianne. You are a young woman, you are a frontline worker, and you are also right at the forefront of the COVID-19 response. Maybe you can also share what fellow women in your field were doing, the incredible, outstanding activities they engaged in Kenya to respond to COVID-19.
Fellow women in my area and in my field came together. It was quite innovative, and they formed an organization and came up with a toll-free number. This number was to be used by any woman who was pregnant and about to deliver in the middle of the night. Remember, during the early days of COVID, there was a nationwide curfew between 6 p.m. and 6 a.m. the following day. So this number was to help these women get to hospital faster, because what we saw were women delivering at home or having complications because they could not get to the hospital because of the curfew. The police got involved, and with this transport system and with the toll-free number, the women were quickly taken to hospitals for safe delivery. So for me, I thought that was quite innovative and met a need of the population that no one had actually thought of. What would happen in the night when there's a curfew and you needed emergency service, or one of the examples was delivery in the night. So that was innovative for me.
Thank you so much for that, Dr. Marianne. We do really celebrate you, as well as your colleagues and other frontline workers who really carried all of us at your backs as you were responding to COVID-19, especially at the early stages when we were at home and you had to be out there to make sure that you keep all of us safe. So thank you so much for that. On the other side, we're going to continue this conversation and hear more from our experts. But for now, let us hear what people on the street had to say.
At a personal level, I am practicing social distance. I'm also making sure that I always sanitize, wash my hands with soap, but also spread the news to other people to make sure that everyone gets the right message about COVID-19 and how we can mitigate the virus.
Mtu kama mimi, mtu wa biashara, imesaidia kwangu, imenisaidia kwa hii mambo ya kuclean, uwe msafi, imenisaidia kwangu, saidi yangu, na hata ninaokaa nao karibu pia imewasaidia.
As a teacher also, I make sure that when I'm with students, I keep on reminding them to wash their hands or sanitize, even to wear their masks all the time, though it's a challenge, with students. But I make sure that I monitor them, since I'm also a mother. When I go back home to my family, I need to make sure that they are protected. So even at home, I make sure that my kids understand and know what to do when they go out in the public.
Really inspiring sentiments from the word on the street. You know, in Botswana, we have a proverb that says, "Mosadi ke thari ya setjhaba," loosely translated meaning that the woman is the cradle of the nation. We are literally carrying not just families and communities, but nations at large. And today, we are actually celebrating and highlighting women-powered activities in response to COVID-19. Before we went on a break, Shamin was telling us her initiatives as a young woman and the work she's doing in Uganda, Tanzania, and Egypt with her artificial intelligence project. But I want us to now reflect on some of the challenges that women also faced and were disproportionately affected by during COVID-19.
Thank you so much for that question. As my colleague said, women are the breadwinners of different homes, of the different communities. And with the coming of the COVID-19 pandemic, there were so many challenges that they really faced. And one of them was the financial challenges. This is because women use, for example, let me give it in a general way, because women usually have to go and the African woman looks for what to eat for her children and make sure that the whole family is okay. And she does it out of all her heart and passion. But when the pandemic came, she was really affected because there was no movement, there was nothing. And then how best would she get anything for her children, anything for her family? So these are challenges that really affected them, that kept them in a lower life than they had been. And when you look at the different communities, most of the women actually were affected even mostly at home because there was a lot of gender-based violence.
Yeah.
We saw on many television, not only in Uganda, but also other African countries, that there was an increased gender-based violence among most of the women. Because they used to be most of the time at home, and then there was nothing, and then some quarrels and all that. So in this, the African woman was affected not only physically, but mentally, because she felt that her family was not having enough. And then she felt she was not doing enough to provide. And then those are things that really affected them. So people like us usually are here to empower other women out there in the different communities who are fearing to come up, or who feel they cannot do it, or who have been discouraged that, hey, you cannot make it. So those are most of the challenges that are really faced by the women in the different sectors.
Absolutely agree with you, my sister. Even in Botswana, we did see a spike in gender-based violence cases. And I think one of the things that COVID exposed is that we really do not have enough services and support mechanisms to help women who are in abusive homes, in abusive relationships and marriages. So that's one of the big things that was coming out. And Reverend, you weigh in about the situation in Ghana and whether you agree with me when I say that I think GBV is one of the biggest social ills in Africa, with very little political will and commitment to overcome and address.
Yes, I agree with you. And especially in Ghana, where there were news that law enforcement agents themselves were the culprits. They were rather abusing young ladies, abusing women. That is despicable. I mean, that is something that should never happen in a decent society. Women have been abused for a very long time. Reading Shamin's profile is such an incredible achievement, her career. Society has come to terms that women cannot be sidelined or trampled over. They must be given space. Yes. And if anything at all, supported with law backing their protection. You know what I mean by backing the law, that our law enforcement, our parliament should be able to enact laws that will punish people that will perpetrate, attacks and violence against women. And then also give good education to some of our women and show them where to go when they need help. One of the challenges that our women faced was maternal health delivery, ANC, the antenatal care. Yeah, they face a lot of challenges. Teenage pregnancies during the COVID times, forced child marriages during the COVID times. These are unfortunate news to hear. So I agree with you. Something must be done to protect our young girls and our young ladies who are coming up, to be like Shamin and to be like Winnie and to be like yourself on the broadcast. Yeah.
Thank you so much. And no need to be apologetic, Reverend. What you're saying is even more powerful because it's coming from you as a man and as a community leader. So you are an ally for women's empowerment and gender equality. I'm going to now go to Dr. Marianne, and maybe as you share your final sentiments, Dr. Marianne, you could just share with us that as a young woman, as a healthcare professional, what would you say are the fundamental things that you still need support on as a young woman in order to continue with your career, to reach self-actualization and just be able to thrive in the space that you are in?
For me, in the space and what I need to thrive so far, particularly in this COVID pandemic timings, is to have more research-oriented funding that actually targets young women who are working in science, who want to meet these solutions and have ideas on how to mitigate some of the issues that we have seen. So we can have more funding dedicated to research, to innovation, particularly targeting young women, because this is where we are the hub and we are the melting pot when it comes to thinking ahead and coming up with solutions. So really, for me, research funds, research opportunities, and ways to mitigate this. So hopefully we can work together as a global community and a global village so that we can address some of these really dire challenges that affect, for me, the African woman.
Really, really powerful stuff, Dr. Marianne, as always. I'm sure there's a young person who's listening to this and they're always inspired whenever they hear your closing sentiments, Dr. Marianne. Thank you so much. And just to end off the segment, I'm going to ask Shamin to come in. And because we are talking about women-powered activities in the response to COVID-19, I want you to close off with a word of encouragement, of support, of inspiration to a young woman who's listening to you right now.
Well, thank you so much for that. To the young women out there are so many challenges that we face. We are not only the women face it, but also the men face it. But because women are delicate and they're really left out in most of the things. So what I'm trying to talk about is that if you're a woman out there and you feel you cannot do it, you feel that you are constrained. Hey, there are some people out there who have gone through challenges and they have been able to go up. So this is life, and we should look more of what best can we bring to the communities. So it's about us knowing that our values, we know that we can make it, and to know that we are important in the communities because we are the mothers of the nations. Yes.
Absolutely powerful stuff. I couldn't have said it better myself. Thank you very much, Shamin. Thank you, Reverend Achampong. Thank you, Dr. Marianne, once more for your time, your sentiments, and most importantly, inspiring Africa. We have definitely come to the end of today's show, and I just want to say bravo to all the women, the ladies, the girls who are out there and contributing positively to the COVID-19 response in your respective communities and countries. We are really, really proud of you. Do make sure that you connect with Africa Health Check on all our social media platforms. We would love to hear from you. Until we meet again, same time, same place. Remember that the future is Africa, the future is today.